Well, good afternoon, and to our fellow Americans out west, good morning. We just completed today's meeting of the White House Coronavirus Task Force, and I'm pleased to be joined by many members of the task force with us for this briefing. I want to thank Secretary Azar, Dr. Birx, and Dr. Fauci, Dr. Redfield of the CDC, as well as our Attorney General, Dr. Giroir of the U.S. Public Health Service, Dr. Hahn and Seema Verma. We'll make a series of presentations to update the American people on the status of the coronavirus pandemic in the country and then be available to take questions. But we very much appreciate the attendance of all who are here and all of you who have made time to tune in. As we reported today, we have now more than 2,500,000 Americans that have contracted the coronavirus. And sadly, we've lost more than 126,000 of our countrymen to this disease. And I know I speak for the President and for every American when we express our sympathies and our deepest condolences to all the families who have lost loved ones. Despite those losses, since the end of our 45 days to slow the spread and the beginning of efforts to open up America, thanks to the cooperation of the American people, the efforts of governors and state health officials, efforts, I want to proudly say, of the entire federal team under the leadership of President Trump, we have made truly remarkable progress in moving our nation forward. We've all seen the encouraging news as we open up America again. More than 3 million jobs created in the last job report. Retail sales are rolling. And of course, the extraordinary progress in New York, New Jersey, Connecticut, and New Orleans, areas that just a matter of a month ago were struggling under the weight of this pandemic and now have arrived at a very, very different place. As we stand here today, all 50 states and territories across this country are opening up safely and responsibly. But with cases rising, particularly over the past week throughout the South, President Trump directed our task force to brief the American people on several topics. First, we want to share with you, as Dr. Birx will, what we're seeing in the rise of new cases that today surmounted 40,000 new cases in a single day. Secondly, we want to speak about what we've done and what we are doing at the federal level to support state efforts, particularly in the states where we see rising cases. We'll talk today about how this moment in the coronavirus pandemic is different than what we saw 2 months ago, to better equip the American people to respond. And ultimately, we will speak about what every American can do to play their part in reducing the spread and the impacts of the coronavirus pandemic. For our part, also, I've spoken to governors in Arizona and Florida and Texas in the last 12 hours. And Dr. Birx and I will be traveling on Sunday to Texas, on Tuesday to Arizona, and I'll be traveling to Florida on Thursday of next week to get a ground report. And of course, on Monday, we will conduct what will be our 26th weekly call with the entire White House Coronavirus Task Force and all of the nation's governors as we meet this moment. Now, as I mentioned, it's important gathering today, I think, that we take a step back and think about how far we've come as a country. When the President tapped me to lead the White House Coronavirus Task Force, he said we had one mission, and that was to save lives. President Trump's decision to suspend all travel from China in January, to stand up the White House Coronavirus Task Force, in February to declare a national emergency, to halt travel from Europe and amend travel from other places around the country, all contributed to giving our nation time to stand up a broad-based response, the whole of government response that we spoke about so many times at the podium throughout this pandemic. The State Department also coordinated the repatriation of some 95,000 Americans. And then came the moment when we brought this chart to the President of the United States on the counsel of our very best scientists. The President was presented with a decision that if we did nothing, no intervention, the possibility existed at that moment in time that we could lose between 1.5 million and 2.2 million Americans. But with intervention and with mitigation, by calling on the American people to embrace the mitigation efforts, social distancing that were called upon, first in the 15 days to slow the spread, that would become 45 days to slow the spread. Our best scientists believe that we could reduce the number of American fatalities to a number ranging between 100,000 and 240,000. The President made that decision, and we unveiled the 15 days that became the 45 days to slow the spread.
And then we gave up.
Inarguably, as we see where we are today as a nation, because of what the American people have done, because of the incredible work of our healthcare workers, because of a partnership with governors in every state, we did just that. We slowed the spread. We flattened the curve. We saved lives. In the midst of that, we exponentially scaled testing capacity, partnering with private sector, commercial laboratories. We've now reached some 30 million tests across the country, conducting some 500,000 tests a day. In that partnership with governors also, the President directed us to make sure that states had what they needed when they needed it. And at this point, I'm pleased to report that the federal government both delivered and facilitated the delivery of billions of supplies of face shields and gowns and gloves and masks, and we continue to be on track to construct more than 100,000 ventilators in 100 days. And as I spoke to governors last night, they confirmed to me again what FEMA's reported. We have no outstanding requests from any state at this time for personal protective equipment or medical supplies. Let me say that again. In the affected areas, particularly the states down south that are seeing rising cases, we have no outstanding requests. But as I told the governors, we are ready at a moment's notice.
The whole nation is affected.
Personnel, to surge supplies, to expand capacity, and to support their health care response.
Here's how we're doing.
In the midst of all of that, I think it always bears saying that because of the great work of our healthcare workers and because of American manufacturing, no American who required a ventilator has ever been denied a ventilator in the United States. I consider that nothing short of a national accomplishment. We also surged hospital capacity in areas of the greatest anticipated need. We sent military and National Guard personnel. These charts showing the progress that we've made in New York and New Jersey and New Orleans all demonstrate the efforts of the people of those states in cooperation with the federal government and all the great healthcare workers to show the progress that we made in areas that were once
There's Jersey. Here's
deeply
Florida.
Jersey. And
Jersey.
we extend our thanks.
Florida.
We extend our thanks
Democratic
to the people
state,
of each of those states
Republican
for the
state,
sacrifices that they made during those great
Democratic
and
state,
challenging times.
Republican
But
state.
at the close of that 45 days to slow the spread, we unveiled a plan to safely reopen America again. And now all 50 states and territories are moving forward. And as I said, we're seeing America go back to work. And in much of the country, we're seeing jobs expanding and economic activity expanding.
Other things expanding. There's Alaska. There's Arizona.
On the advent of a rising series of new cases across the American South.
And the majority of states. It's not just the South people.
Our first mission was to save lives. Once we came out of the 45 days to slow the spread, what our task force has been focused on over the course of the past 2 months is to partner with states to save lives and safely reopen. In fact, we've had some 17 meetings of the White House Coronavirus Task Force in the intervening days since we began the process of opening up America again, and we've been working very closely with states to move that agenda forward.
Let's take a look at one of those southern states.
As the president
This
made
is
clear,
Alaska.
We want to
I'm
open
not good
our
with geography,
economy up,
but
and we want to move America
see?
forward, even while we take and continue to take the steps
Southern.
necessary to protect lives and the health of the American people. We stand here today because with the rising cases among southern states, President Trump asked us to brief the American people.
Let's take a look at another southern state.
What we're seeing.
This is
what we're
Florida.
doing,
Nope, sorry, that's Idaho.
and how it's different from 2 months ago.
Southern.
As you may recall, after seeing overall cases drop from a 30,000 a day average in April to 25,000 a day of average in May, the first few weeks of June actually saw cases averaging roughly 20,000 new cases a day.
Because of the work
now
in New York,
have
New
seen
Jersey, and
cases
Connecticut.
begin to rise precipitously across the South.
This has got to be Florida. This is in the
fact,
South? Yeah. Oh, no, this is
34
Minnesota,
states,
so this is up north. So their cases are
34
falling.
Let me make sure I've got my numbers exactly right here.
We're just going to cover this. There. See?
As we reported
Everything is
early on,
fine.
34 states across the country, though, are experiencing a measure of stability that is a credit to all of the people of those states. And when we speak about
Are they, though?
stability, we are talking about not necessarily states where there are no new cases, but these would be states where there are either no new cases and no rising percentage, or no combination of those two things.
You know, the
There
northern
may be
states
states
like
across the
Montana.
country that are seeing
Yeah.
a modest increase in cases, but their percentage of positive rates is remaining very stable. And but nevertheless, there are 16 states with rising cases and rising percentages. And we'll be
rising
focusing on those
percentages.
states today. The first thing we'd share with the American people is that while there's
the
a
coronavirus.
penchant in the national debate to use a broad brush and
penchant.
to paint an entire state one color,
Yeah.
if there are rising cases in a portion of the state, this is actually a better picture of the data that we literally analyze every
We've gone
single
household
day.
by household
Dr. Burks will
to
take
make
a
it
few
look like
moments,
Hillary lost the
to,
popular vote.
Unpack the specific outbreaks in Texas, Florida, Arizona, and California. But the first thing we would convey to the American people is that from
Democrats
this
are
new
bad.
positive results in the last 3 days, you can see the concentration of new cases in specific parts
Are they
going to
give that to us so we can see
and
it?
of course, very specifically in parts of parts of the country. Secondly,
They don't have a feed set up for
we want the
C-SPAN.
American people to understand it's almost inarguable that more testing is generating more cases. To one extent or another, the volume of
I
new
can argue
cases
it.
coming in
The cases exist,
is a
whether you
reflection
test them
of a-
or
of a
not.
great, success
The
in
testing does
expanding
not
testing
generate the
across
cases.
country. As I said at the top,
The cases
we're testing
exist.
more than ever before, some 500,000 people
Morning, Producer
a day,
Joanna.
and perhaps we could go to that testing
Hey,
chart
Chris.
if
Hey,
it's
Arthur.
there,
Good to see
just
you,
show
Stern.
the
Welcome.
acceleration
Marcy,
of testing
Kim.
that's taken place over the course of this pandemic.
Damn that
in the
testing
United States.
that
It's
you keep
truly
bragging
been,
about.
remarkable, and it's been a public and private partnership from the very outset.
Hold on. Here you go.
One of the things that we're seeing among the cases, and we hear this in Florida, and we hear this in Texas and elsewhere, is that roughly half of the new cases are Americans under the age of 35, which is at a certain level very encouraging news, as the experts tell us, because as we know so far in this pandemic, that younger Americans are less susceptible to serious outcomes of the coronavirus. And the fact that we are finding more younger Americans who've contracted the coronavirus is a good thing.
Hey, Carol.
And so
Hey, Danielle.
we'll speak about the testing, and Admiral Brett Giroir is here and can detail any questions that you might have about testing going forward.
Why we never got those 21
Thirdly,
million tests he promised by the end of March.
What these new numbers mean and how we can address them. And Dr. Fauci will speak about that in just a moment, particularly in the affected areas. And the other area that we spend a great deal of time thinking about is hospitalization. Not only do we track new cases every day on a county-by-county basis, but we also track hospitalization. And the map on the left of your screen represents how
left of my screen. I don't have it on the left of my screen. Okay, so the C-SPAN feed just paused on us here. Hold on, kids. See if there's anything I can do on my end. That is a C-SPAN error. Or let me check my internets.
The resources and support they need. Again, as in the matter of new cases, you can also see with hospitalization, it's highly focused, highly detailed, and highly specific. Secretary Azar will speak about hospitalization, the work of HHS to make sure that our hospitals around the country have the capacity to meet this moment. But as Dr. Birx may well reflect as well, we are encouraged that where 2 months ago we were seeing some 15% of new cases being hospitalized, now that number is averaging roughly 5% around the country, which is also encouraging news, to say the least. And so while we have 16 states that we're focusing on, again, I would just reiterate to the American people, the most useful thing to know is where it's happening so that you can take the steps necessary to do your part. But rest assured, in our conversations with governors in all of the most impacted states, we continue to be assured that hospital capacity remains strong, and they know the federal government stands
except
ready
where they're out of capacity. Alberta, if you're having problems, go to youtube.com/Heavenly Father.
Capacity and personnel to meet.
I'll shut him up for a second. If you're having troubles chatting, go to youtube.com/Heavenly Father, and the chat there usually works. It seems to be working here today. And we've got Danielle in there moderating.
Available. Finally, I want to speak about the progress that we've made as a country on the most difficult aspect of this. I said at the beginning that our hearts and our prayers go out to the families who've lost loved ones in the course of the coronavirus pandemic.
That'll make it all better.
I know I speak on behalf of everyone in this country when I extend our sympathies to the more than 126,000 families that have lost loved ones. As the President has said many times, one life lost is too many.
So he's resigning.
I believe at this point in the course of the pandemic, we can still take some comfort in the fact that fatalities are declining all across the country.
And they're going to start going up again.
There was a day 2 months ago this week where we lost 2,500 Americans in a single day. This week, because of the extraordinary work of our healthcare workers, because of the availability of new medicines like remdesivir, new treatments like steroids, and because of the cooperation of the American people, heeding the guidance that we gave at the federal level and state and local officials gave, this week, there were 2 days where we lost less than 300 Americans. And you can see from this chart what has been a precipitous decline from some of the worst moments of this pandemic as it impacted areas of New York and New Jersey and the Northeast. Again, I have a heavy heart anytime I recite these numbers, but the fact that we are making progress, reducing the number of Americans that we have lost and are losing, I hope is an encouragement. Because as we see new cases rising, and we're tracking them very carefully, there may be a tendency among the American people to think that we are back to that place that we were 2 months ago, that we're in a time of great losses and great hardship on the American people. The reality is we're in a much better place with the efforts President Trump mobilized at the federal level, with the efforts of this team, this whole of government approach, the efforts of governors across the country, our incredible healthcare workers, and the cooperation of the American people. We're in a much stronger place.
Are we?
The truth is, we did slow the spread. We flattened the curve. We were able to stand up the resources and the capacities in our healthcare system.
And then we opened up
to meet
the
this
whole
coronavirus,
fucking country again.
In a way that would put
And this is where we are.
the health of all of our country first.
41,000 new cases.
We also cared
Going
for
back
the
to
most
April, there's
vulnerable and
31,
continue to
34,
focus resources
33.
in testing and supplies on the most
Today,
vulnerable seniors with serious underlying conditions.
Right now,
And I too believe with all my heart that we've
41,000
continued
cases.
to save
Higher
lives.
than that today,
We've
'cause
created
Florida
a
just
solid
reported
foundation for
9,000
whatever
by
challenges
itself.
come, either in the days ahead or in the months ahead. And that's a credit. That's a credit, I believe, to our president, to our federal team, to our state partners. But mostly it's a credit to the American people and our healthcare workers. And so we stand here today. We believe we've made progress.
Italy has made progress.
As we see cases rising,
That's what we're supposed to see.
across the South, that we still have work to do. And so we say to every American, particularly those in counties and in states that are being impacted by rising cases, that now's the time for everybody to continue to do their part.
Like
And I
Spain.
think you'll hear from this podium today a particular
That's
message
Spain.
to younger Americans across the Sun Belt, and the role that you can play in protecting the vulnerable, and making sure that while the coronavirus doesn't represent as significant a threat for a serious outcome to a younger American, none of us would want to bring the disease back to our parents or grandparents, moms and dads, an elderly friend, or a friend who has an immunodeficiency and cause a serious outcome as well. And so we leave you just with the guidelines for all of the phases. When we put out the guidelines to open up America again,
Oh, that'll help. Thank you.
we laid out.
It's worked out really well for Florida.
At the outset, guidance for responsible reopening, and states across the country, as I mentioned, are doing just that. 34 states are reopening safely and responsibly and seeing low and steady cases and not seeing a rise in the percentage of positives. And in the 16
See what he's saying there?
being impacted.
He said the percentage of positives, not the new cases. The majority of states are seeing a rise in new cases. But now they're trying to be like, oh, the percentage of positive, that's 34.
Avoid touching your face.
Their time will come.
People who feel sick should stay home. And when it comes to businesses, social distancing, protective equipment, temperature checks, testing and isolation. These are the guidelines for all of the phases. And they are good
so employers
practices to
test your people.
to implement.
You know,
if you're
because
in a
with all those
community that's
tests you've got
affected,
laying
or even
around
if you are
the
not.
break room.
Because we're all in this together. And the progress that we made, that you saw illustrated in those charts in places like New York and New Jersey, Connecticut and New Orleans, was
Democratic states. The states with the poor management,
forward, heeding the
where
guidance
all hell is broken
of
loose.
federal, state, and local authorities. And we encourage you to continue to do just that.
Progress. Okay, he paused again. There he is.
At home and at work and in your community.
Yeah, the pausing is on C-SPAN's
for
end,
those
guys.
in the
If you're on
areas most
Twitter,
affected, we just want to encourage you.
it's not Twitter that's doing it, unless
to
Twitter's
listen to
misbehaving.
and respect
I don't
the
know.
guidance of your state and local authorities.
Do
Recognize
not
that
listen
this
to the
is
guidance of your
different
state
than
if you
2
live
months
in a
ago, both
Republican
in our
state.
ability to respond and in the nature of those that are being infected, and that younger Americans have a particular responsibility to make sure that they're not carrying the coronavirus into settings where they would expose the most vulnerable.
Shouldn't Bernie
And,
be up there telling us this?
And lastly, as I prepare to bring Dr. Birx to the podium, I just encourage
You know how
every
Pence
American
relates to the
continue to pray.
kids.
Pray for all the families that have lost loved ones. Pray for our healthcare workers on the front lines.
At
Just,
random, that
continue
depends
to
on
pray
how many cases you actually
that, by
have.
God's grace, every single day, will each of us do our part
Yay,
to
God!
heal our land.
Yay!
That, I'll introduce the
Hooray for
coordinator of
God!
the
Just cover
White House effort on
that hand.
coronavirus,
Here,
Dr.
there.
Deborah Birx.
There you go. Yay for God! Number one.
Thank you, Mr. Vice President. Thank you for that great introduction. Just to remind everybody where we have come from in the last 4 months, we have a great deal of
The introduction. Now here's Dr. Scarf.
infections. No,
Thank you for that
we believe
great
everybody
introduction.
is susceptible to infection.
The president is
But we know
data-driven.
infection leads to a spectrum of disease, and we have much better details about who is vulnerable and why they are vulnerable.
Everyone.
And as the Vice President said, at one time, we were diagnosing people in the ICU after they came into the emergency room. And
I'm gonna
thanks
spend
to
this
the
entire
millennials who
time
have
trying
been
to read her
heeding
scarf.
our guidance, they have been coming forward and getting testing. And so whereas before we told them to stay home, now we are telling them to be tested. And this is a great change for us because it allows us now to find the asymptomatic and the mild diseases that we couldn't find before. As Dr. Redfield talked about yesterday, from the serology test, we have a great understanding of what
Hey,
was
Lizzie.
happening in March and the number of asymptomatic and mild conditions that led to individuals to have antibody but never come forward with significant disease. We now know who's at risk for significant disease.
Are you going to share those details with
It's
us?
particularly the elderly, individuals over 80, and individuals with comorbidities. And remember, those comorbidities span the entire age group.
Yep.
We do know
Obesity.
that we have people in the younger age groups with significant type 1 diabetes
Uh-huh.
and may also have individuals with significant obesity. We know that those are risk factors, and so risk factors go with your comorbidity, not necessarily with your age.
And now,
And so
please
as
welcome.
we call on individuals to protect one another, by passing someone on the street, you don't know what comorbidities they have.
Dr.
And this is why
Scarf.
we've been focused on trying to protect one another.
With their
We
tribute
also
to the
know
alphabet.
who's at risk for the highest mortality, and because of that, we've been able to, the clinical care has dramatically improved. And I want to thank
All
NIH,
of this is killing
who's
my
been
eyes,
working
Karen.
constantly to
Hey,
update
Kathleen.
the clinical guidelines. So physicians around the United
Hey,
States
Dr.
and frankly
Hillbilly.
around the world who are using those have the most updated information about how to actually improve disease courses of those that are in the hospital. We, of course, have improved treatment in the hospital that we didn't have in March and April, with improved methods of oxygenation, which is really quite important, improved treatment of acute respiratory distress, that's that individuals on the ventilator, we know now will respond quite well to steroids. And then research that is ongoing on what we call the acute cytokine storm. That is when often in that later stage when people are on ventilators, the seriously ill may need steroids and other items, and that's being researched. And the work that's being done on clotting research by the NIH. We also have new therapeutics that have
Steroids?
been used both as compassionate use like convalescent plasma, and now remdesivir that we just
Remdesivir.
reallocated and ensured it was available to these states that are facing the increased hospitalization, as well as the monthly allocations that we have been sending out. If we can go to the first slide, please, and start where the Vice President left off. Really, this disease is tackled community by community, testing at the community level and working with community groups to understand the spread in those communities. And so we've spent the time to really map this epidemic and new positives down to the level of communities to understand where spread is occurring so that we can match our prevention interventions to those areas. Next slide, please.
We didn't
As
see
we
the first
discussed,
one.
and it's difficult for you to see on this
There we go.
graphic because the top line is New York. And we should remember where we were and that slope, that early slope that you can see in the case of the New York cases, that rapid acceleration. On the same slide, you can see
And this
California. That is the
purplish
blue
line
that is just
ahead of
passing
this
the
other
orange
purplish line.
And also on the
And there's
slide
a
is Texas
sort of a
in
purplish
green,
line
Florida
here.
and orange.
Well, this slightly darker
and
purplish
Arizona
line
at the bottom.
is, well, under this,
As
this is,
dramatic
I'll call
as
this
these slopes
violet.
are, they are not
The violet
equivalent
line,
to the
if you look
original
at the
acceleration
top,
that we saw in New York.
this is
That
sort of
doesn't
a-
mean that we aren't absolutely
like a medium
focused
purple.
on working with the governors in those communities to stop the spread of the virus in those 4 states. Next slide, please.
No slide.
This shows you through the entire country that we're tracking state by state. Now, obviously, this axis is vastly different than the one on the prior slide because that slide included all of the cases in New York City. But you can see on this slide that we've been tracking very closely North Carolina. A team's been in with North Carolina, working with the state and local public health authorities to really respond to the changes there.
This is North Carolina.
As the South Carolina at the bottom. Next slide, I'll just go quickly through these so you can see Oklahoma's at the bottom of this slide. And next
Oklahoma.
slide.
Nope.
You can see on this slide Idaho and Oregon. Those are the ones in the light blue and the dark green where you see an inflection in their slopes. These inflection points and understanding when they occur and why they occur are critical for understanding how to prevent the spread. Next slide. Now, what the Vice President talked about is we've created an alert system
this
that
slide
brings
is giving us the finger, and that's what we see here, holding up its middle finger.
With an understanding of test positivity.
We tried to make the font as small as we possibly could.
For you to see
it is difficult for us.
States on that far side that have the highest test positive that you can see at the higher level of the graph.
Here.
Those are the states that we have concerns about because of the rising number of cases and the rising test positive. This explains the extent of community spread. In states that have increasing cases but falling test positives, it tells us that they're getting into the communities to find the asymptomatic cases. And so these are the things we put together to understand the full picture. Next slide, please.
Oh, it's full picture. Next slide.
So this really puts on one slide the states that we have that we've been talking about across the South where we have our greatest concerns. The two top states with the largest increase in test positives are Texas and Arizona, followed by Florida, Mississippi, South Carolina, Alabama, Georgia, Louisiana, Nevada, and Utah. Those last few states are under still 10%, but we're tracking them closely as we look at that individually.
Hold on. Republican.
Oh,
she didn't let me finish.
We are tracking, and this is when you hear about we have a certain 2% or 3% of the counties under specific alerts. So it doesn't matter the size of the county, we're tracking the increase in the rate of increase in new cases at the county level.
Hey, King County!
We currently have about
130
counties out of the 3,100 in the United States in that category. Next slide. Metro level, this shows you the case positivity by the metros and the number of tests that have been done. Next slide. And then this shows you specifically the change over time of test positivity in the largest metros where we have concerns, and this is Austin, Phoenix, Houston, Dallas, San Antonio, Tampa, Orlando, Miami, Riverside, California, and Atlanta at the bottom. And so this is how we continue to integrate data on cases, data on testing, and data on hospitalizations so that we can work with the states for a
have a lot of numbers.
Integrated
what
response.
are we going to do?
Next slide. I know many of you would be interested in seeing how high the test positivity rate became in April and March and April. So that top line is New York City Metro, and you can see it reached over 50% on a series of days for almost 2 weeks. 50% of the tests were positive for COVID-19. Underneath that, you see New Jersey and Minnesota and a whole series of individuals. Detroit is the second large mountain. Next slide. So quickly to show you how we look at this at the state level and work with the governors and the local health authorities. So this is Florida. We track testing, it's done, the number of test positives that are in the blue line, the total number of cases seen in the black bar, and what we call the syndromic presentations
of
early
look at the number of tests.
Diseases.
This is the number of tests completed. They go down while the positivity rate goes up.
Then we look at the county level
Florida has
to look
stopped
for
testing,
changes in the slope of the number
many
of
of those
new
tests
cases.
might be delayed in terms of getting the results.
Top county that has the largest increase in slope in cases is Miami, Miami-Dade, followed by Broward and Palm Beach. All the other counties are much lower in their daily case increases. This allows us to focus resources and testing along with the state into these specific sites. Next slide. That all comes together to create this graphic so that individuals can understand and we can understand precisely what the rate of growth is and where the rate of growth is occurring by the shading of the boxes. Now I'm going to quickly take you through Texas because it's the same story. Next slide. So this shows you the exact same graphics now shown for Texas, showing a continued rise in the daily tests performed, but also a rise
so this is
in
daily
the
tests
test
performed.
positivity, the blue line.
This is also
You
positivity.
can see throughout May, after opening, their test positivity continued to decline as their testing increased.
And we're done? Hello?
Along with rising testing. But it was the increase in test positivity that alerted us,
Hey, Denise.
along with the increased cases, that this was becoming an alert. You can see in the red boxes, everything is heat mapped. So at a glance, you can tell those two boxes that are in the middle that are red.
What?
That's the heat map showing that this has rising cases and rising test positivity. Next
No,
slide.
we
but
cannot
even
see
in
that.
Texas, next slide, please. And this gives you a map of Texas, or shows where the cases are and where they're rising the most rapidly. And finally, I'm just going to go through Arizona very quickly, along with California. So next slide.
Exactly.
Same
At
situation
random.
that we're showing
Which per
here
capita
with
are they
Arizona,
using?
rising number
And what is
of
she
tests
telling
being
us with
performed,
these?
but
Yes.
also rising test
Cases are going up.
positivity, rising
Positivity is
cases.
going
Next
up.
slide.
Testing,
Arizona
except in
is unique,
Florida,
and they have
is going up.
essentially one county that is primarily represented by the depth of the new cases, and this
we're
is
not
in
gonna
the
count those
Phoenix
people?
area.
And
Next
that's
slide.
where we had the rally.
Then
Smart.
next slide. So this is California. And so you can see California over the last week has had that increase in test positivity. You can see that dramatic increase at the end of that bar
Right
in
here?
the blue line.
Yeah.
Along with still increasing test positive
all these
testing
tests.
that has been done. And we just want
That's
to
good.
thank
Good
all
testing.
of the governors and all of the work at all the laboratories that has allowed us, along with HHS and Brett Gerard, who ensured that the supplies were there to really increase these orange lines. You could see in each of these cases, these orange lines have dramatically gone up over the last 4 weeks.
No.
Next slide.
Keep your family there, Jana, and make
like
sure they
New
vote.
Mexico, the primary infections
In
right
Florida.
now in California at the highest level are in
In
the
fact,
LA
you should move to
area.
Florida so you can vote in
But because
Florida.
LA is a large metropolitan area, next slide, you really need this kind of more specific and local graphic to really show that it's also increasing in the among agricultural workers to improve testing and isolation for those who become positive. So I just wanted to take you through how we've been looking at data, how we consolidate that data, and then Monday report it out to the governors. We hope over the next week to be able to really have this data available in real time.
Dr.
on
Lisa
the
brings
White
up a
House
good point.
website
If
so
we
that
didn't
everybody
have
across
people,
the country
we would
can
not
see
have
where
cases.
the cases are.
Boom.
Because in the
Take
end,
that,
we really
libtards.
want to call to action. When we started talking about what can be done, we said the most important thing that would change the spread, and I'm going to turn that over because I know Tony's going to talk about it, is really individual
Wait,
behavior.
Fauci still has a voice?
And our respect for one another through social distancing, wearing a mask, and ensuring that we're protecting the most vulnerable that may be in multi-generational households. And I just want to end by thanking again the millennials who have come forward. And I know during the protests we asked a lot of them to go forward and get testing, and we see those testing rates really improving in the under 40 age group. That is going to be important to continue to accelerate testing among the under 40 age group, because that's the age group most likely to have asymptomatic spread and be spreading the virus unbeknownst to them. And I want to really make it clear, no one is intentionally spreading the virus, but they don't know that they're positive, they don't have symptoms, and need to be tested in order to have that awareness. And so we really
I will
want to thank
fact
them
check
again
that
for
right now.
coming forward
Anybody
and really
deciding they're not
enriching
going
the
to wear a
amount of
mask
testing
is
that has been
intentionally
done in
spreading the virus.
under
Fact
40-year-old
check.
age group. And to our older population, you know if you have comorbidities, you know if you're over 80. We ask you if in these hot spots in these states that are having expansion in cases to continue to shelter as much as you can and use your grandchildren to go and do your shopping.
Thank you very much, Dr. Birx, and thank you, Mr. Vice President. So I want to extend just for a couple of minutes some of the comments that were made both by the Vice President and by Dr. Birx, and it has to do with the situation that we find ourselves facing right now. It's very clear from the maps that you saw that there are certain areas in the country, states, towns, cities, regions, that are doing very
The
well,
country.
that have followed the guidelines and are opening up in a prudent way that's been effective. However, as you can see, we are facing a
Yes,
serious
use your grandchildren to do
problem
the
in
shopping.
certain areas. Now, when you look at
Make
the
them
map,
pay as well.
it's very interesting because you see some dark parts of the map and some light parts of the map. We have a very heterogeneous country. But heterogeneity does not mean that we are not intimately interconnected with each other.
Ooh,
So
he's
what
talking
goes
sexy.
on in one area of the country ultimately could have an effect on the other areas of the country. So let's take a look at this problem that we're facing now.
So
this
butterflies
resurgence of
spread it?
cases. I don't think there's time enough
First
now
the mortar
all day
hornets.
to try and analyze and figure out the multifaceted elements that went into that. You know, everything from maybe opening a little bit too early on some to opening at the right time, but not actually following the steps in an orderly fashion, to actually trying to follow the steps in an orderly fashion, but the citizenry did not feel that they wanted to do that for a number of reasons, likely because
They're
everyone
idiots.
feels
They're
the common
idiots.
feeling of being pent up for such a long period of time.
I'm okay.
So we're not going to say blame, we're not going to try and analyze it, but there is something that's very important about it that I'd like to get a message to the country in general. When you have
Stay
an
the
outbreak
fuck
of an
at
infectious
home. Oh,
disease,
no, hold on, sorry.
it's a
That's
dynamic
sure he was
process
gonna say that.
that is global. So remember, what happened
Dynamic
in China
process that's
affected
global.
us.
He's
What
talking our
happened in
language,
Europe affected
common
us.
Americans.
What's happening here is affecting others. We can't get away from that. It's interconnected. So therefore, if we are an interconnected society, we've got to look at the fact of
Build
what
the
our
wall.
role is
Build- no?
in trying to put an end to this. Because everybody wants to end it, everybody wants to get back to normal, and everybody wants the economy to recover. I think we all are pretty
What?
common in that. That's a given. So, what can we do?
But the president
think
keeps
upon
saying that
talking
that's
to a lot
not
of
the
people
case.
and reflecting
He's saying
on
that
it,
Democrats
we have
want to
such
keep
an
the economy
unusual
shut to
situation
hurt
because of
him.
all of the decades
That's
that I've been
literally what the
involved
president
in
of the
chasing
United
infectious
States is
diseases.
saying.
I've never seen anything that is so protean in its ability to make people sick or not. There's
Protean.
no other infectious
This-
disease.
he's a man
that
of the
goes from
people.
40% of the people having no symptoms, to some having mild symptoms, to some having severe, some requiring staying at home for weeks, some going to the hospital, some getting intensive care, some getting intubated, some
He needs
getting
longer
ventilated,
arms.
and some dying. So that depending on where you are in that spectrum, you have a different attitude to this particular thing. But anyone who gets infected or is at risk of getting infected, to a greater or less degree, is part of the dynamic process of the outbreak. And I know because I can understand when I was at a stage in my life when I said, well, I'm invulnerable, so I'm going to take a risk. I think what we're missing in this is something that we've never faced before, is that a risk for you is not just isolated to you. Because if you get infected, you are part, innocently or inadvertently, of propagating the dynamic
Or
process
stupidly.
of a pandemic. Because the chances are that if you get infected, that you're going to infect someone else. And although you may feel well, and because we know, if you look at the numbers that you'll probably hear later on, the overwhelming majority now of people who are getting infected are young people, likely the people that you see in the clips and in the paper who are out in crowds enjoying themselves, understandably. No blame there,
But they're
understandably.
having fun.
But the thing that you really need to realize, that when you do that, you are part of a process. So if you get infected, you will infect someone else who clearly
Yeah, I
will infect
will.
someone else. We know that happens.
High five,
because the
Fauci.
reproduction element of the virus is not less than one. So people are infecting other people. And then ultimately you will infect someone who's vulnerable. Now that may be somebody's grandmother, grandfather, uncle who's on chemotherapy, aunt who's on radiation or chemotherapy, or a child who has leukemia. So there is what I call, and again, I just want to bring this
Fauci's
out
cat
without
got his tongue
making
in
it
it,
seem
went in
that
there and
anybody's
clawed
at
his
fault.
throat.
You
Poor
have an
guy.
individual responsibility to yourself, but you have a societal responsibility. Because if we want to end this outbreak, really end it, and then hopefully when a vaccine comes and puts the nail in the coffin, we've got to realize that we are part of the process. So when the vice president went back, pulling back a couple of months ago, when we showed about the guidelines to safely reopen the country.
And were
We've got to
completely
make sure
ignored
we
by many
drop back a
states.
few yards and think about that this is part of a process that we can be either part of the solution or part of the problem. So I just want to make a plea with people when they
But
understand the stress
being part of the
that they're
problem
under
is
as
fun.
we try to tackle
Don't you get it?
not only those states, but the light-colored part of the country, even though they've done well. They
Good
may
for you,
have gotten
Barb.
hit badly like New York and then came down, or they may not have got hit badly at all. They are vulnerable. If we don't extinguish the outbreak, sooner or later, even ones that are doing well are going to be vulnerable.
Please, they're
to the
making
spread.
please.
So we need to take
In
that
other
into
words,
account
saying,
because
please,
we are all in it together.
stop
And the
whatever
only
it
way
is
we're
you're
going to
doing.
end it is by ending it together. Thank you.
It's a plea to the kids.
Well, first, thank
Oh,
you all for
good.
joining us here at HHS to update the American people. I want
It's
to begin by
the
thanking
coronavirus,
everyone
Azar.
around the country working to defeat this virus. All of the healthcare providers on the front lines, those working to reopen our economy safely, the American people who have sacrificed so much in this fight, and the incredible members of our HHS team who've been working tirelessly to protect the health and well-being of all Americans. Before covering today's topic, I want to mention a major milestone for global health yesterday. The end of the second largest Ebola outbreak in history in the Eastern Democratic Republic of the Congo. We congratulate the Congolese government and all of the healthcare workers and community members involved, some of whom I had the chance to meet and thank in the DRC last fall. Under President Trump, the United States was proud to play a bigger role in this major public health victory than any other single nation. And now, thanks to the President and the Vice President's leadership and the hard work of our team, America has never been readier to combat COVID-19. We've built up our readiness under the strategy we developed to address surges, save lives, and in time defeat the virus. We're in a much stronger position to support states, hospitals, and individuals as they fight back. There are 6 parts to the strategy: surveillance, testing, containment, healthcare capacity, therapeutics, and vaccines. First, we've been strengthening surveillance so that we can be aware of and respond to surges. That means, for instance, being able to track more cases among younger Americans that
We
we
should
never
have watched
would
this
have caught
delayed
earlier in
because
the
I'm
pandemic.
not even listening to Azar.
Second, we have the world's greatest testing
Make sure you wash your hands with
enabling
hot
us
water.
to confirm the presence
That's
of the
the
virus
Secretary
when it crops up,
of Health and Human
we're
Services
confident
telling
that
you
capacity
to
will
do
continue
your
to rise in the
hygiene
coming months.
improperly.
Third,
Warm water,
states are
cold
building
water
the
or warm
capacity
water.
to
Don't
track
wash
and
your hands
contain
with hot
outbreaks
water.
of the virus.
But this is what he said.
With federal help, many
He's
states
in
have
charge.
substantially expanded their own capabilities, and we're deploying knowledgeable, experienced CDC and HHS public health teams to the areas now seeing increases, with a focus on community testing and community-based interventions.
Okay, fast forward. Get
Fourth,
to the
we're
end.
helping healthcare systems secure sufficient capacity and supplies. We've dramatically expanded American manufacturing of PPE, and the FDA has authorized new technologies to sterilize equipment for reuse. We've spoken with hospitals and states that are building up their own PPE reserve.
That's better. Oh, that's much better.
Through the Strategic National Stockpile, we have far more visibility into the supply needs across the country, including centralized coordination capability.
Yeah, so Yakima County in Washington is out of hospital space. So they're sending their patients to the neighboring counties and now even to Seattle, which is about 4 hours away by car. So they're airlifting patients to Seattle because they've run out of beds in Yakima County. Yakima's not that big, but of course, you would think every area would have as many ICUs as they need for their general population. Yakima's exploding.
Already saved thousands of lives. We've identified 2 very promising pharmaceutical treatments, remdesivir and dexamethasone. As of today, we've allocated more than 120,000 courses of remdesivir to all of the 50 states. We've added dexamethasone, a very low-cost steroid, to our treatment guidelines, and we believe it's reasonable to assume that other corticosteroids, which may be more readily accessible in some places, would have similar immunological effects. Another promising therapeutic, convalescent
So
plasma,
this is
has
Washington.
been used to treat more than
There you go.
25,000 Americans in nearly 3,000 sites
Yakima
across the
counties.
country.
This is Yakima right
There
here.
are no
And then
certainties in
Seattle's up
science,
King County.
but with more than
So
140
they've
clinical
started,
trials underway in the U.S., it's a
sending
pretty safe
patients
bet
to
that more good
Benton,
news on
which has
therapeutics is
hospitals.
on the way and on
Kittitas
the way
has
soon.
some hospitals.
Finally, we've
Klickitat
announced large
is
investments
not
to
that
support 3
populated,
different
and this is not that
vaccine
popular either.
candidates
It's
all
a
the way
lot of
through to
migrant
manufacturing.
workers.
These candidates
this
are
is
now
where
in human
peaches,
clinical trials,
apples,
some with the potential to start
various
delivering
fruits,
safe and
figs.
effective
They actually have
doses
pretty good figs in
before the
Yakima.
end of the year,
But
and we'll
apple
be
juice,
adding
if you
support
drink
for
treetop
several
apple
more
juice,
candidates.
It probably came from
We're
Yakima.
expanding manufacturing
They're
capacity
sending-
and already
it's about a
making the vials,
3-4 hour
needles,
car
and
ride, all
syringes
their
that we may
patients
need.
now up to King
Our
County,
capabilities
Seattle.
have grown exponentially in the time allowed by the patriotic sacrifices of the American people. We have a much better grasp of the
I probably should have shut his audio for all that, but all right. Hopefully you guys can hear me above him.
Today, we can focus on local trends. We have some very concerning hotspots, and we can track when other hotspots emerge, as we expect they may. We're focused on the states and the counties within those states, just 3% of counties that represent hotspots. It's important for the American people to be aware of this variability and variation across the country. Americans need to understand their local trends because we want to help people make the right decisions for themselves. Making decisions for yourself has to be based on 3 axes of risk, as our Surgeon General taught us in March. You want to assess where you are, who you are and whom you live with, and what activity you're thinking about doing. There are gradations of risk within each of these axes. Going to an outdoor restaurant in Montana is a great deal different from a crowded indoor bar in Houston. When you interact with fewer people in an activity, when you interact with them for a shorter period of time, your risk is reduced. And individuals can balance these kinds of factors. What I've laid out today is remarkable progress by the President's administration, and a particular credit to the team here at HHS. We've got a lot of work ahead of us, but Americans can be confident that we have a rock-solid foundation to help us get safely back to work, back to school, back to worship, and back to health care, while we tackle surges of the virus where they occur. Thanks to President Trump's leadership, we've got the capabilities, the knowledge, and the strategy to protect Americans' lives and their livelihoods at the same time. And every American should feel proud of that. Thank you.
Great. Great.
Okay, let's take a look at Pasco here. Someone had just asked about Pasco. They've got family. Oh, so Marcy, yeah, you've got family over there. Let me get out of the way. So
Thank you, Mr. Vice President.
this is
I wanted
hospitalizations.
to add some comments. Once again,
That's
I
right,
want
Phil.
to stress and thank
We're going to shut down Redfield for a second here. So this is Washington State. Here's Seattle area, etc. This is hospitalizations by county. King County right in here, that's Seattle. This is Yakima down in this area, and then Pasco, Kennewick, the Tri-Cities in Washington, that's down in this area. So the current hospitalization is, 271 to 360, so they're right behind Yakima. So make sure you tell your relatives to stay safe.
vigorous hand hygiene. And to commit to do so, as we've heard today, to do our part to protect the vulnerable. I also want to appeal to the millennials and those that are under 40. It's really important that this group really commit themselves
Yep, bring in Redfield
to
to
these practices
to talk to the
protect those
kids.
at risk. And it's not just the elderly that are at risk. Many of us may have friends and colleagues that are younger.
I'm trying to think,
that
like,
may
does the
not,
White House have
advertise
anybody, any
their
staff that would appeal to the kids?
comorbidities,
I mean, besides
as the
Stephen
case
Miller.
would be with, say, type 1 diabetes.
Seriously,
an
Bernie should be
underlying
up there.
Immune deficiency.
The White House
So,
should ask Bernie
again,
to speak to the
asking
kids.
This team of millennials and younger people in this country to come and commit themselves. I agree with Ambassador Birx. We're very thankful that the group is now coming forward to get tested. But I also want this group to put into vigilant practice.
Thank you, Danielle.
the
Yeah,
importance
if
of
you want
our
to help
social
me, then
distancing.
give me a like.
The one thing that
And
I
a-
wanted
a
to
thumbs
stress,
up.
though, is that
Thumbs up for Corona.
there are differences
Corona 19.
in what we're experiencing today than what we all experienced
And a
in
retweet
March
if you're
and
on
April
Twitter.
and May.
And
And one of the things I want
You
us
can
to
become a
focus
patron. Go
on
to
is not the
kevinleefather.com.
cases per se, but the consequences, the impact. of
Fauci's
those
good with
cases.
anybody.
It wasn't long ago probably within 2 months ago.
He's falling
It's hard
asleep
to
back there.
believe. I don't think many people realize that 27% of all deaths
Poor Fauci.
that occurred in the United States actually died of a pneumonia. That was a pneumonia, could have been influenza,
Great.
could have been COVID.
Great, Redfield.
27%.
Let's give the
1 in 4 of
conspiracy
all the
theorists
deaths
some
in the
bait.
United States just 2 months ago was caused by pneumonia.
Yeah.
I'm happy to say today, the deaths to pneumonia in this nation is back to baseline. It's about 7%. It's a big difference. A lot of those pneumonias that were dying were actually COVID-infected individuals that were the elderly, nursing homes, and individuals with comorbidities. We are seeing, despite these increased cases, we have seen a progressive decline in deaths.
Just
The
wait.
last, say, 2-week
Wait
average
for it.
deaths in the
That's the
United
way
States
it
now is
works.
around 650.
This
And as
guy's
you
in
heard
charge of the
Vice President,
CDC.
It wasn't long ago that sadly we were losing 25,000 individuals a day. So I think it's critical that we continue to focus on that, the consequences. And it's part of that why it's important that we continue also to look forward to how we deal with and contain and control the COVID infection, but as we also change the consequences of the impact it's had on education in this country.
What's on his
or
mask?
as
I
an
believe it's
economy and
chloroform.
business. So again, as I close, I want to just re-emphasize how important
Oh, re-emphasize.
for now.
Yeah, he said that
for
we just
individuals
we
to
missed
really think
Fauci passing out on
seriously, as
stage
Tony
there.
said,
You know
about
why? Because he's
the
losing oxygen because he's
responsibility
wearing a
to others
mask.
that we have, because this
Fact check.
infection pathogen really does have the capacity
Fauci.
to cause quite serious illness in individuals at high risk, and embrace our nation's recommendations that the Vice President put up again, that we have for all phases of reopening America. Again, I also want to thank the younger groups for stepping forward and getting tested. Clearly, what we're seeing now is this age group is much more likely to be
No,
asymptomatic.
I feel so badly for
And
Fauci.
again, to make that commitment to do their part to protect those of us that, whether we're young or old, have a comorbidity and would be more vulnerable to serious illness from
I'm
this
here.
virus.
I'm awake.
Thank you
I'm
very
good.
much.
I'm good. Everybody, I'm good.
Thank you, Dr. Redfield.
Anybody who could make it
questions?
through that speech standing right beside him,
Yes, please.
All of the
National hero.
experts here within the task force are stressing the importance of social
Yes, I have a question.
distancing,
This is for
and also
Dr.
with
Anybody.
crowds.
What the fuck?
Yet your campaign has held 2 massive rallies, no social distancing, no masks. Can you tell me, even Dr. Fauci has talked about not gathering in large crowds. Can you tell me why you continue to do this, why the campaign continues to hold these rallies?
Well,
Because you
The
got to
freedom
have
of
Corona
speech.
Bowl.
the right to peaceably assemble is enshrined in the Constitution of the United States. And we have an election coming up this fall. And President Trump and I believe that taking proper steps, as we created screening at recent events. And,
No, that's
and,
bullshit.
Giving people the very best counsel that we have. We still want to give
The very
people
best
freedom to
counsel?
participate in the
Don't
political
come here.
process.
That's
And,
the very best counsel.
we respect that. I was pleased to see.
Can we
that
please
now,
let Fauci answer this?
the better part of a week since we were in Oklahoma, I think their positivity rate is actually declined as of today. And,
No.
that's a great testament to the fact that
If
people are using common sense. They're being responsible.
because the numbers for today haven't come in yet. So when he says as of
And our
today,
emphasis
it's
today
because the
is
graph
really to
makes it
say
look like
that,
it's lower because
we
it
think
takes a
it's-
couple of
it's
days
most
for them to
helpful
get the results in.
if the American people understand that what we're seeing across the South today is really outbreaks. There are outbreaks that are in specific counties. In some cases, there are outbreaks that are in specific communities. And we've surged CDC personnel, HHS personnel. I didn't mention before, but 3 weeks ago when we were seeing similar activity in North Carolina and Alabama, we sent personnel into those states, and we've actually seen declining numbers beginning in both of those states. So the important thing is that not one size fits all. The overall
The Tulsa
guidance to
site is
every
down, by
American
the
to
way. So many
practice good
people are hitting on it
hygiene,
right
to
now
practice,
that the
the
Tulsa
measures
Health
that we recommended at
site
home and
is
at
not
work,
loading.
stand. But our focus today is to make sure that in those areas of the country where we're seeing a significant not only increase in cases, but an increase in positivity level, that the American people know just how important it is to listen to what their state and local health officials are directing them to do. Please.
I was curious, it seems like the wearing of masks has kind of become a political statement, or I guess the decision not to wear a mask. Are you concerned about that? And is there a message that you would like to send to people about the importance of wearing masks?
Well, we think that where the first principle is
Seb,
that
I don't
ought
think
to
people
listen
should
to
be
their state and
gathering
local
together
authorities.
anywhere.
I mean, I
And if
have
they
to tell
are,
you, President
you have
Trump
to
and I
wear a
couldn't
mask.
be more grateful for the partnership we forged with governors around the country.
Riots? People, nobody should be
I spoke
rioting.
to the governor
Are
of
you
Florida,
supporting
Arizona,
raids, Seb?
Texas.
God,
just
does anybody
within the last
in
12
here
hours.
support riots?
And I
Just
told
raise your
them
hand
that
if you
from
do.
this podium today, we would remind their citizens
It's an odd question.
to heed the guidance and the direction of state and local officials. In some cases, there's statewide guidance with regard to facial coverings and with regard to events and gatherings. In other cases, there are specific countywide or citywide directives. And we just believe that what's most important here is that people listen to the leadership in their state and the leadership in their local community and adhere to that guidance, whether that have to do with facial coverings, whether it have to do with the size of gatherings. And we'll continue to reinforce that message. Please.
So he didn't really answer the question.
The importance of listening to state and local authorities. What is the correlation between the spike in cases that we're seeing in states like Texas and Florida and the way those states handled their reopening? Was it too much too soon? And secondly, I wanted to ask Dr. Fauci, you said in an interview that, quote, something is not working. What isn't working? And did you all in your meeting today come up with a plan to fix whatever isn't working?
Well, let me respond first, and then I'll let Dr. Fauci address it as well, and Dr. Birx may as well. I think there will be a temptation for people to look at these Sun Belt states that have been reopening and putting people back to work, and suggest that the reopening has to do with what we're seeing in the last week or so. But frankly, in the case of each of these states, they reopened, in some cases, almost 2 months ago. And their test cases, their new cases that from testing was low and steady. Their positivity rate was low. What we're observing today, and I've heard this from Florida,
I appreciate it, though,
I've heard this
Dr.
from
Lisa.
Texas, and some other states along the Sun Belt, is that we're seeing more and more young people
It's the
under
kids.
the age of 35.
So that's smart.
who
Blame
are
the kids
testing positive. In
and
many
then
cases, they have
make
no
a personal
symptoms,
plea to them.
but they're coming forward and confirming that they have contracted the coronavirus. We're working with the states. You speak about our plan. We've got CDC personnel embedded in every state in the union. We're surging more CDC personnel as requested to each of these states to help them unpack what the data is suggesting. I know the governor of Texas announced some new measures this morning, which we fully support. But what we're going to continue to do is give our state leadership the very best information, the very best counsel that we have. And if there's one message that comes through today, I hope it is saying to younger Americans in these states and in these counties in particular that they are a big part of the numbers that we are seeing in new cases. And while there may not be a significant threat of a serious health outcome to them, I know of no young person, and I got 3 20-somethings in my immediate family. No young person would ever want to inadvertently expose.
Keep in mind that for months, the information coming out of the Trump campaign administration was old people, stay home. If you're in a vulnerable population, stay home. They never told the kids to stay home. They said, if you're sick, stay home. If you're old, stay home. And now, this is what fucking happens.
So what I meant by what is not working, and this is not anybody's fault or any institution's fault, is that what we're
It's
dealing
the Trump's
with right
fault.
now
Trump.
is community spread in the
Yeah.
context of a substantial proportion of the people who are getting infected do not know they're infected, they're not symptomatic, they're asymptomatic individuals. The classic paradigm of identification, isolation, and contact tracing to actually contain that is very difficult to make that work under those circumstances. You superimpose upon that the fact that even with identification, isolation, and contact tracing, often the dots are not connected. If you get on the phone and talk to people who are in some of these communities, you
That's a
find that
nice
lot
way
it
of
is
saying
done
these
by
people are
phone.
stupid.
And when it's done
The
by
dots
phone, maybe
are
half
not
of the
connected.
people don't even want to talk to one who they think is a government representative. If you live in a community
mistrust
that is
in
mostly
government
brown or
agencies. I
black,
wonder
you're
where
in a
that
different
comes
situation
from.
That maybe 70% of them don't really want to talk to you. You can identify a contact, but you don't isolate them because you don't have the facility to isolate them. That is what's not working. So what we're going to do, and we are doing, and you're going to be hearing about this.
Andy, I hope your wife is okay. What are the post-recovery symptoms she has?
Particularly among the asymptomatic.
I guess she's not really
So in other
post-recovery.
words, it's a paradigm
Post-infection
shift,
symptoms.
because we're dealing with young people, people who are going to be asymptomatic, and people who are getting infected in a community setting, not an outbreak setting where you know who to identify, isolate, and contact
Right,
trace.
which was
That's
why
what I
it was a
meant.
huge mistake to emphasize old people at the very beginning. I knew this was going to happen. Why doesn't anyone listen to
I
me?
just want to finish it, expand his thought for just a second.
Oh, I'm gonna correct
about 3
it.
months ago, we talked about how
Here comes the
important
propaganda.
it was to have community at the center. And I think when you talk about what's going to be different, and part of the reason why the president and vice president have asked me to go out to Texas, New Mexico, and Arizona, is to not only meet with the state and local health officials, but to meet with the community groups, so that the community groups can help us support community-specific messaging. Public health messaging,
She
when you just
still
keep saying the
has,
same thing over
Andy,
and
this
over
question's
again,
for you.
and the
She still
people
has
get
a
toned
loss
up to
of
it,
smell and
it's because
taste?
it's not tailored to their specific circumstances, and they don't see that message resonating in their lives. We've had to do this across the world.
You're welcome,
I've done this
Hillbilly.
over
I
and
yell
over
for
again
you.
For HIV, TB, and malaria. At the center of this has to be the community, and the community will help us identify who needs to be tested. They'll help us identify which households have the most vulnerability in them, and how we can really go into those communities and support that response at a very local and ground level. When we started this, we were very much facility-based, and we know facilities carry us a long way. But if we want to change the transmission rates in these metros, in specific communities and in specific parts of those metros, we've got to walk side by side with our community leaders and our community groups
Wow.
that know how to translate our scientific dogma and information down to a level where people will understand it, hear it, and act on it. I know when they hear
Just
it and
put
understand
me
it,
in front of
they
the
will act
microphone.
on it. And
I
so
will
that's
say,
how, when you ask
hey,
what's going to be
kids,
different,
'cause, you know,
that is
I
already
talk to the
started,
kids.
and it's already going to be different.
Dr. Burke.
You know,
Knock it off.
Just let me add to that. That's exactly what we did with HIV 30 years ago. We got the community involved in helping us to outreach. And I think that's very important to underscore what Dr. Burke said. And that's exactly what's being planned.
I should
to
be
do,
broadcasting
to
this
get
on
people who know
Instagram.
the community,
I'm already on
who live
Twitch.
in the community, who the community trusts.
Right, let's go.
Okay, this
about right
this
here?
is what I was saying a half an hour ago.
Do you expect the death rate to go up in the next 3 or 4 weeks, just like we're seeing the rate of infection go up now?
Well, you know, math.
Well, our hope and our prayer is that it's not the case.
Yeah, the prayers are not going to be
We've
answered,
seen,
big boy.
As you noted, we've seen a precipitous decline in fatalities. And again,
Right, and now we're
one is too many. We grieve the loss of every American life. But the fact that 2 months ago,
Do we? Are you
lost
grieving
2,500
127,000
Americans in a
people
single
right
day.
now? Because it
In
doesn't
2
seem
days
like you
this
are.
week, we
Because
lost
you're not
less
wearing
than
a fucking
300
mask.
Americans.
I just think it's so fitting that the guy who's the most religious person in the world is not wearing a mask and not getting the infection, which tells you that there clearly is no God.
Testament to the efforts of the American people, and we hope as we continue to engage that we'll continue to see those numbers decline. The other reason we're encouraged is because at this point, when we look at our losses, roughly 2.5% of all of our losses took place in people under the age of 25. I mean, younger Americans, and in each case,
So 3,000
at least 90%
Americans.
of the cases, they were people with pre-existing conditions.
3,000
underlying conditions that
young people
contributed,
is enough to fill
the
one flight
sad
on
outcome.
American Airlines.
So as we see that in Florida and in Texas, they've reported to us that half or even more than half of the new cases that are showing up.
I don't know why I always
every
pick on
day,
American. I have no
are
beef with
people
American
under the age of
Airlines.
35
They're just
or
the first
younger
thing that comes to
Americans,
mind.
in most cases asymptomatic.
Because he keeps saying Americans,
Our
so
hope
that's
is
the way my
that-
brain works.
that those
I should
younger,
say
healthy
Spirit
Americans,
Airlines,
like
they
most
lost my
have
hockey
already, will
stuff.
continue to go through
But I got
the
it back.
coronavirus, will recover. But our message today, as we've spent so much energy in the last 4 months protecting the most vulnerable. I mean, we've deployed testing resources, we've supported states' efforts. States across the country in the last month have answered
Yeah,
our
Andy,
call
what
to
about you?
test
Are you
all the
getting any
residents of their
long-term
nursing
symptoms?
homes, to set up a plan to test all of the staff on a regular basis. We need to protect the most vulnerable, and we want a message going out to younger Americans, particularly those along the Sun Belt, in these counties where we see
Well, then
new
you're the
cases
guy
on
to
the
give that
rise,
message.
positivity on the rise, to know that we need them to do their part to make sure and protect the most vulnerable.
You
so
should
that we
reach out
can-
to the counselor
so that
you
we
had in
don't see
conversion
those
therapy.
losses rise, but it's in the hands of the American people, and particularly young people in this country.
All right, guys, last question.
Wow. Wow.
Thank you. A question for you, and then
Just-
for the doctors on childcare.
Sure.
On the campaign, it really does sound, though, like you're saying, do as we say, not as we do. You're telling people to listen to local officials, but
Thank you.
also you defied local health officials. To have an event that, even though you say it didn't result in a spike, dozens of Secret Service agents, dozens of campaign staffers are now quarantined after positive tests. And then in Arizona, one
Here's
of the hardest
Tulsa.
hit states, you packed a church with young people who weren't wearing masks. So how can you say
I
that
love
the
her.
campaign is not part of the problem that Dr. Fauci laid out?
Well, we
I
have to
wanna
hope
remind
and
you again
pray.
that the freedom of speech and the right to peaceably assemble is enshrined in the Constitution of the United States.
God. The
And
Constitution
even in a
is
health
trying to
crisis, the
kill
American
you,
people don't
America.
forfeit our constitutional rights. And
Forfeit
working
your.
with state
You don't
officials,
have to have a campaign rally.
as we did in Oklahoma.
No one is
as,
forcing you. You're not going to lose your
as we
liberty
did,
because you
in
go to
Arizona.
Phoenix or don't go
We're
to
creating
Phoenix.
settings where people can choose to participate in the political process, and we'll continue to do that. I think it's really important that we recognize
Not spread
how important,
infection. That's what's important.
how
You're
important
killing
freedom and
people.
personal
Young
responsibility
people.
are to this
You're
entire
responsible for your
equation.
grandparents, so
But
come on down to the
allowing
rally and we'll
younger
talk about it.
Americans- Allowing younger Americans to understand, particularly in the counties that are most impacted.
Maricopa County, where you
and
had
the unique
the
challenges that we're facing in their age group, we think is important. But look, it's so important that we recognize
God,
that
baby
as
Jesus.
we issued guidance
Young-
to reopen America now 2
young
months
people.
ago. And now as all
Look,
50
it's-
states are opening up our country again. People
And
are
it's
going
the
back to work.
economy, President Trump's
American
leadership.
Everyday life is being restored, kind of one step, one day at a time. I think it's important that we remind
Constitution.
ourselves this is not a choice
So
between
important.
the health of
This
the
is-
American people
To
and a strong
America,
economy. There are profound health implications
broad-shouldered leadership.
to the lockdowns through which
To-
we just passed.
To-
I
and a-
heard a statistic not long ago at
A rally.
at a task force briefing
but it's
that in one jurisdiction there'd been a 50% increase in the number
Numbers.
of people
Numbers,
presenting in
numbers.
emergency rooms having attempted suicide.
it's
And there are profound
suicide
mental health issues.
is
There are profound economic issues. People needing to
painless,
be back to work.
full.
And
MASH.
And so we're
America
Our objective here today is just to make sure the
military.
American people know. In
And
34 states,
Trump
the cases are
numbers.
largely stable. and
Numbers.
There's no combination of rising cases
Currently,
and rising
But
positivity rates. That's
if
a
we
tribute
look
to the
at
American
the
people.
best case,
And in the 16
rosy
states we're focused
si-
on
let's
today,
pick cherries.
we simply want
If
to
just
equip particularly young people with the
God
knowledge of the part
and
that they can play in
thoughts,
stemming the rising tide of
Prayers?
new cases, not
And
because the coronavirus represents a
Corona.
significant threat to them. In most cases, it doesn't if you're a younger American. But because
President
we don't,
Trump
no younger
will-
American would ever want to spread
was
the
the
coronavirus
question?
to someone who would have a serious outcome. But I'm grateful for the time today. We hope this has been helpful.
And thoughts?
We'll be back with
Thoughts.
more information as time
And
goes
also
on.
prayers.
Fauci, are these rallies okay? Are these
Dr.
mass
Fauci,
rallies
Dr.
okay?
Fauci, Dr. Fauci, Dr. Fauci! I hope that nobody within a 3-mile radius of me is trying to make phone calls right now. We did it, everybody! America is safe again. So that gave us all the answers for the questions we weren't asking, so that was nice. I don't know what to tell you guys, except, yeah, this is... You miss Fauci, but you can go back and watch him again. And Fauci was, what did he say? He had a great insult talking about how people are not getting it. He didn't say people aren't getting it. He didn't say people are idiots. He just said, people are having a problem connecting the dots, which is the nicest way. That's what I'm going to tell people from now on. I don't know that you're connecting the dots on this necessarily. Oh my God, Sherry, I can hear you screaming from here. Wow, what a meandering verbal kitty litter load of garbage at the end there from Pence. And what a fantastic question from this reporter right here. This reporter, I don't even know who that is. For some reason, she's hiding behind a mask. She's America. She's the whole world right now looking at America going like, so did you... It's like that GIF, the guy with the... How are you guys? So there's other stuff coming up today. Let's take a look there. Thank you. I often say like, hey, it's great having you guys in here, you guys chatting. This is just to the people in the chat room. Everybody else who's not in the chat room, hold on just for a second. To the people in the chat room, I always say like, oh, you guys make me you help me get through this and da da da. I seriously mean that today, because here there was a glimmer of, I don't want to say hope, because come on, there's no such thing as hope anymore, but there was a glimmer of maybe in my heart when I heard that the Coronavirus Space Task Force was going to do a thing today. That maybe there would be something there that we could hold on to, and then it would be given to America and say, here you are, hold this in your hands and cherish it. This is the way out. Follow me to freedom. No, that is not what we heard today. Instead, baby Jesus. Thoughts and prayers. Got nothing against Christianity. My mother was a Lutheran minister. I was an altar boy. Okay. But what I'm saying is, to those of you who do join the chat room, I appreciate the fact that you're there. And it gives me solace that some of you are still alive at this point. Anybody want to see their state, let me know and we can pull that up. In the meantime, let me look at the schedule here, because we do have Trump speaking about something later. Trump delivers remarks at 2:40, which is 11:40. So let's say half an hour to an hour from now, we'll bring the live stream back on, and I hope to see you all there. Again, to everybody who's not in the chat room and is watching, or is watching this delayed, hey, how are you? Good to see you. I hope you're doing well. Stay safe. If you'd like to support this broadcast, like the people in the chat room over there, and some people who aren't in the chat room over there, and some people who honestly, they're like, I don't have a chance to watch because I'm working, but I really appreciate what you're doing, and I want to support you. And thank you to those people. Go to kevinleefather.com, and you can become a a patron there, or a patriot, and support me there, and I appreciate that. And the little thing that you just saw there right before the marquee, which we'll get out of the way in a second here, if you want to make a one-time payment and become a PayPal, just like these good people did, coming up in a second here, the Forgotten PayPal, Ruth Ann K. I saw her in here today. Thank you, Ruth Ann. And new PayPaler, who's also here, going by Andreas today, Andy Crowder. Andy, I hope I'm spelling or saying your last name correctly. I can't spell it correctly with my font. I can't put the little dots above. So Andy, Andreas Crowder, thank you very much for your support. You can do that by going to paypal.me/KevinLeeDad. You don't have to type out the father. It's Kevin Lee Dad. Paypal.me/Kevin Lee Dad, and you can go right into the PayPal and you can make a one-time payment, or if you want to subscribe with your payments, you can stop anytime. Go to KevinLeeFather.com. Producer Joanna said, you should take your glasses off when you're making your call to action. That's what I'm calling this. No, you take care, Chris Wilson. And if you want to establish a foundation, a 501c through the government, and use that foundation to make a grant of 38 cents per annum, like Chris Wilson, reach out to him. He knows how to do that. Of course, it depends on what state you're in, but Chris knows all the red tape involved in that. And we appreciate that. Not a lot, but, 38 cents worth. Dr. Lisa, good to see you. Take care of yourself. So we'll see most of you, I'm sure, in, like half hour, an hour, or whenever the president delivers remarks on the American workforce. That sounds like something he'd be doing. So we'll have another Corona rally, basically, in about an hour, I'm guessing. And we might get some footage at some point of him touring some sort of factory. I don't even know where he is. Hold on, let's take a look at the president's schedule. And I hope it's okay with producer Joanna if I put my glasses back on for this so I actually know what I'm reading. I'm almost 50, people. Okay, president's public calendar. So Morristown, president departs Morristown. Oh, wait, no. That's been, I've heard rumblings. Maggie Haberman tweeted, I believe, that the trip to Morristown to his Bedminster, New Jersey golf course has been canceled for the president. So let's see. This is in the East Room of the White House. So he's not going anywhere. He's just addressing the workforce from the White House, where everyone will have been tested for the coronavirus. Man of the people. Okay, I missed the Florida numbers. Well, they're up. They won't. The Topus chart that I show won't include today's number, which are over 9,000 already today for Florida. So, yeah. So Dr. Lisa actually showing anything right now. Every place, not every place, a lot of states are spiking, but 34 states have positivity in hotspots. Certain counties, Jesus Christ, blood, corona, and strong, broad-shouldered leadership should be in jail. Hillary. Emails. I could be a vice president. 9,000 cases in Florida already today. Okay, it's time for me to go, guys. Here are the closing credits. We'll see you in a half an hour to an hour.